Hi, I am Dr. Surekha Tiwari. I am a psychological counselor and a homeopathic physician. Fungal infections can be very irritating. They cause inflammation, they cause a lot of itching, they cause a lot of pain after the itching also. What we need to understand about fungal infections anywhere in the body, they require three things. They require moisture, they require heat, and they require a little darkness. That is why we see fungal infections coming more in all the folds of the skin, be it under your arm, be in your private parts, or be it under the breast as well. So, to take care of these things, the first thing which you could do is to keep these areas dry. So, you cut out the moisture. How to keep it dry is one, if you sweat a lot, then you ensure that you use a talcum powder so that there is no residual moisture in the area. The second thing is making sure that you soap these areas regularly because fungus propagates by the spores. If the spores are washed from the skin, you cannot have the itching continuing for too long. And to cut out the oxygen supply of these areas, you can apply any moisture, any oil right after your bath. When your skin is damp or moist, at that time itself on the affected area, please apply a little oil and rub it well so that the moisture escapes and you have the oil left. This cuts off the supply for the fungus and does not allow the fungus to regrow because fungus can be more obstinate than we are. So we have to be consistent with these processes. In homeopathy especially, I don't know about the others, but we have something called a dusting powder. You can even use a dusting powder on the area in which you're having repeated fungal attacks. It will reduce the itching, the inflammation, as well as the discomfort. And it will also reduce the course of the fungal infection. Fungal infection in the private parts is only because there is moisture and there is some kind of spores which have been left behind. Any kind of infection of the clitoris or any other infection in the private parts can be very well dealt with. A, if you change your undergarments at least twice a day. B, each time that you change your undergarments, if it is possible, wash yourself with soap and water and follow it up with an application of any oil or cream which is handy, which will allow the spores not to propagate and also for the infection to come under control much sooner. For the better aeration of that area, wear loose pants or loose palazzos, which will allow the area to breathe better. And also, if you can try to make sure that your clothes are breathable, so more cottons, they allow for the skin to remain healthy and have its own immune system freaked out completely. You will not have the fungus coming back again. Do not wear clothes which you have worn once so that the spores do not propagate. Wash yourself well after every visit to the bathroom. That also helps. The spores of the fungus should be taken away. If that can be done, then fungus will not come back. Ringworm is a type of fungus. There are many types of fungal infections. Ringworm is a type of fungus in which you have something like a ring infection. The periphery stays red and there is a central clearing. Often it has a concentric spread. It keeps on spreading in all the directions and the central clearing will be there. One of the things which I've seen works very nicely for infections is turmeric. You can apply turmeric mixed with a little oil and apply it all over your fungal area, especially on the periphery. It allows for the area to remain, it breathes very well, but because turmeric is an antiseptic, it does not allow that area to expand and also reduces the inflammation and the itching which causes itself. The second thing which helps is ghee and turmeric. You can heat a spoon of ghee, to that you add a little pinch of turmeric, heat it little warm, and with a cotton swab, you can apply it on your fungal infection. Fungal area, the ringworm where you're having it, it does allow for the area to become quiet and remain calm, comfortable.